think that the first thing, in terms of people's perceptions, people have this perception, as per your title of the podcast, that the system is very fragmented and data doesn't flow well, and they're correct. I would say it's probably, however bad they think it is, it's probably worse than that. People are usually surprised when like, oh, I can't believe that this data wasn't accessible here, or I had no idea that literally no one ever test results or whatever. So they don't usually realize kind of how fragmented it is. But the other thing that they really don't realize is how absolutely normal that is. Canada is a little bit under average in this regard, but basically every country, every jurisdiction struggles with this to varying degrees. It's a really hard challenge. And I always like to think of it as consumers who use technology on a day-to-day basis. People feel like technology should be really easy and seamless. I think like the Google search box is like the ultimate deception. That this little box, you type something in and the thing you want appears. And it feels like, yeah, this is just easy. But like behind that search box is 25 years of, tens of thousands of the greatest geniuses in the world creating a thing that is much more impressive than the Great Wall of China. Like there's an incredible amount of stuff that goes behind that goes behind ChatGPT. These are all engineering marvels when they work. And so when you have sectors that aren't the best of the best of the best that are using technology, you tend to get a lot of messiness and complexity. And so if you go to an airport and you go to the WestJet counter and you say, hey, I'm flying Air Canada, can you just check me in? They'll be like, no, our systems don't do that. I mean, we just kind of like assume like, of course, it's fragmented between airlines. And of course, restaurants don't have each other's data. And of course, like all these other sectors are fragmented. And so healthcare is at the like really tricky nexus where expectation is integration, but the execution isn't at the level of like the mega beautiful tech world. And so you get this sort of misalignment between how people think things should work and how they work in practice, because actually building a massive integrated system across tens of thousands of organizations is like a really hard thing to do.
Yeah, I could imagine. And I guess like us thinking about the impact of that in this industry compared to others and how that engineering marvel now becomes 10 times more complex as well, because now you have different cultures, different organizations, different types of things. Would you be able to maybe elaborate a little bit more about over the last, now you've been working in the digital health system for maybe well over 20 years, seeing kind of the eras of everything. How has that kind of like progressed? Like from working in the ministry to working at Santis, you've kind of seen it all. How has that evolved for you?
Yeah. So I've just sort of celebrated my like 20-year digital health anniversary.
Congratulations. That's
Well, my
amazing.
career is roughly 20 years long, I think. And I would say, like, honestly, the most noteworthy part of this is how much less has changed than I expected. When I was first sort of introduced to this world 20 years ago, it felt like we were on the cusp of like this incredible radical transformation where everything was going to be different. And 5 years after that, it didn't feel that different. And 5 years after that, it didn't feel that different, et cetera, et cetera, et cetera. What I think has changed is that like virtually every interaction with the healthcare system involves digital technology in some way. Like it's quite rare now to like walk into a primary care practice and it's all paper. The administration side of thing, especially scheduling, workflow, sure, billing, there has been legitimately a lot of digitization, but the actual experience of care doesn't feel that different. And I think the last 20 years of digital health, frankly, has been like a real mixed story as to like if someone told me like, hey, we're going to snap our fingers and there's going to be no computers in healthcare anymore. We're going to just like flash back 30 years. It's going to be the way it was in 1996. I would think like, oh, that's going to be a problem in a bunch of ways, but also maybe better in certain ways.